So prior to doing your trach care, make sure you have your supplies. First, you need sterile water and hydrogen peroxide. This will be the solutions that you will use when you do the trach care part. You want to make sure you gather your tracheostomy care tray that looks like this. In the hospital, we are now using disposable inner cannulas, so ensure you grab an additional inner cannula that's the same size as your patient's, and you want to grab an extra pair of surgical gloves in your correct size. So prior to trach care, you want to ensure that your patient is in the proper position, raising the head of the bed at least 30 degrees unless contraindicated. You want to remove the oxygen source from your patient, but keep it nearby just in case you need it. Then you want to remove the dirty dressing from your patient's tracheostomy and dispose of it in a biohazard bag.
Okay.
After the dressing has been removed, this is your opportunity to assess the site and the site around the stoma and inspect for any signs of infection, drainage, or anything that's abnormal and report it to the MD. Now we are preparing to set up our sterile field. So before you create your sterile field, you want to make sure you pre-open your hydrogen peroxide and your sterile water, leaving the caps on. You want to pre-open your new disposable inner cannula. And now you will open and prepare your sterile field. Okay, now we are going to prepare our sterile field. So when you're opening your packages, always make sure you open the package away from you. As you can see here, the gloves are the first thing that are exposed and they're not wrapped. So you can go ahead and place your sterile gloves on now. Then you will take your sterile drape. Remember, the first outer inch is considered unsterile at this point, and make sure you always do the shiny side down. You will take the basin inside and you can dump your contents in your sterile field and fix the tools that you need and that you don't need. Since we are using non-disposable inner cannulas in our facility, you do not need to use some of these items, so you could just put it off to the side. So in this field of your sterile contents, what you will utilize is your sterile 4x4s, your new dressing, and then your cotton tip applicators. Now that your sterile field is set up, you will then now contaminate or make this your clean hand, your non-dominant hand. You will pour equal parts of sterile water and equal parts of hydrogen peroxide into your sterile basin. You will now go to remove your inner cannula. You will take your non-dominant hand to stabilize the outer cannula, and with your sterile dominant hand, you will go in and remove your inner cannula and dispose it in the biohazard bag. After removing your old inner cannula, ensure that you remove your gloves, do hand hygiene, and prepare to put on your second pair of sterile gloves. Now that you have on your sterile gloves, okay, you will use your non-dominant hand to stabilize the plate. My hand slipped. With your non-dominant hand, you are going to stabilize the outer cannula. And with your dominant hand, with your new disposable inner cannula, you are going to insert, making sure that you hear the locking of the connector adapter. Now we are ready to perform our stoma care. So with our sterile dominant hand, we are going to reach into our sterile field, grab sterile 4x4s, dip it into the solution, and make sure you wring it out so it's not excessively wet. And we are going to clean the stoma, ensuring that we go in a circular motion, and we will only wipe in one direction and dispose, like this, in your biohazard bag. And you will keep repeating this motion until you have gotten all of the contents clean from the stoma site. And you will use the cotton tip applicators for areas that are harder to reach. Still in the same circular motion, one direction, and dispose. When everything is clean, you will now grab your new dressing and you will apply the new dressing around the tracheostomy. Once you are done, now you can return the suction source back to your patient. I'll connect your patient